Topic on apexification is a method to induce a calcium barrier across an open apex of an immature pulpless tooth. Its objective to induce either closure of open apical third of root canal or formation of calcific barrier against obturation. The materials used for apexification is calcium hydroxide. It's mainly used MTA, recently used tricalcium phosphate, collagen calcium phosphate gel. Apexification with calcium hydroxide. Preoperative radiograph to be taken to find out apparent length of tooth. Tooth anesthetized, rubber dam isolation, access opening done, irrigation done with sterile water and saline. Working length determination is done using a radiograph. And working length 2 mm short of tooth length to prevent injury to apical tissue and thin walls in apical third. After cleaning and shaping of the root canal is dried using blunt absorbent paper points. Calcium hydroxide is mixed with sterile water to thick consistency on sterile glass slab. By means of thick blunt finger plugger, the paste is forced into the root canal. Dry pellet is forced into a root canal with the blunt finger plugger until root canal is filled with calcium hydroxide. Seal access cavity with intermediate restoration material. Recall the patient in 3 months to determine whether calcific barrier has developed at or near root apex radiographically. Apexification using MTA. After proper isolation and anesthesia, access cavity is prepared to allow debridement of necrotic pulp tissue. Working length kept 2 mm short of working length and gentle circular filling is done. Irrigation with sodium hypochlorite. Paper points to dry the canal. MTA is mixed according to the manufacturer instruction and introduced into the canal. Using MTA carrier. MTA is condensed into apical 3 to 4 mm. Moist cotton pellet is placed on MTA to ensure setting and temporary restoration is placed. Patient recalled after 48 hours. Obturation and permanent restoration. Thank